Monday, May 1st is Doctors' Day across Canada. Niagara Health Chief of Staff and Executive Vice President Medical, Dr. Johan Viljoen, joins us. Doctor, how many physicians are in the Niagara region?
So we probably have close to 1,000, if not more. We have 600 physicians who are credentialed with Niagara Health, and then we have physicians working in the community who don't have credentials with us, but we certainly recognize them every year at Doctors' Day because they contribute so largely to the care of our community.
Doctors' Day has been around for not a long time. It's not something that has been recognized for decades and decades. But what is important for us to think of on that particular day?
I think we need to just take a moment to think about what doctors do in their contribution to healthcare provision. I'm a firm believer that healthcare provision is very much a team effort, and I do not ever minimize the contribution that nurses and allied health professionals bring. But this is the day where we celebrate doctors. I think it's important for us to celebrate not just the big ticket items, not just those things that we see, doctors do based on their expertise and the difficult surgical procedures they do, the fancy diagnostic things they do, the cancer treatment. All of those are important and we need to recognize them. But I think it's important for us to also think about the unseen work. People often don't realize that the doctor's day and responsibilities don't end when their encounter with the doctor ends. Many things happen behind the scenes and happen after hours. There's the hundreds of phone calls and prescription renewal requests and just sitting with patients. There are still those doctors who go out to homes and do home visits. If they didn't do those, some of those patients would never receive care. So there's a lot of unseen work that I feel we must celebrate more openly.
As Chief of Staff, what does your day look like on May 1st?
Well, it's a regular work day for us, and I will make every effort I can to do rounding wherever I can and where I don't disturb doctors at their work, but just to acknowledge that we recognize what you do, we see what you do, and we know what you do when you're not here, and the impact that that has on your life and on your family's life. We are just sort of shrugging that sort of soggy coat of a pandemic. Not quite yet, but we're sort of walking away from it. And at this Doctor's Day, I also think I would like to just remind my colleagues, time to take care of yourself, time to focus on yourself, time to start again enjoying your families, your children, time to get back to attending soccer games, attending concerts at school. So this is really an opportunity to start looking at starting afresh.
Dr. Viljoen, I know that the physicians gathered for their annual dinner just last week. What goes on at that dinner?
Well, first of all, I need to shout out to the Medical Staff Association who represent us as physicians and the executive, particularly Dr. Alison McTavish is our president. And the Medical Staff Association does this on an annual basis for us. And as always, it's a fun evening where we get to meet with each other. And it's so much more meaningful now that we can do that a little bit more freely than we did in the last 3 years. So it's a fun evening to reconnect. And our Medical Staff Association during those meetings also recognizes specific physicians for their accomplishments over time.
I have to say that I was at the Niagara Health Gala just last month and was very impressed by the number of doctors who stepped up during that time and contributed money to the fundraising campaign for the South Niagara Hospital.
I'm right there with you. I was so proud of my colleagues. And to me, it's about more than just the money that they contributed. But to me, if I were a big donor with a big pocket and I saw physicians step up the way they did, I would read into that, these folks believe in their hospital system. And if these folks believe in their hospital system, so should we. So I'm really hoping that that message got through, and I could not be more proud of my colleagues.
Dr. Viljoen, I have to say that as Chief of Staff, you certainly set the bar for them as well. Happy Doctor's Day, Monday, May 1st.
Very much appreciated, and I'll pass it on.